seniors should use baking soda. This way, 13 health issues can be alleviated. You likely have a box of baking soda sitting in your kitchen cupboard. But consider this. What if I told you that this simple, inexpensive, and harmless powder gathering dust on your shelf can address various ailments, from joint pain to inflammation? Modern research confirms that baking soda can help with 13 serious age-related conditions, including pain, kidney issues, and high blood pressure. What's particularly surprising is that 99% of seniors have never heard about this from their doctors. In this video, we will explore 13 beneficial properties of baking soda, from the most subtle to the critically important. The number one benefit can reduce the risk of death by more than 60% in high-risk individuals. One study claims it can extend life by up to 10 years. Most seniors are unaware of this. Please share in the comments which city you're from and where you're watching this video. Now let's move on to point number 13, which is the least noticeable but relevant to millions of people. Number 13. Relief from heartburn and acid reflux. If you've experienced a burning sensation after eating, you know how unpleasant it can be. In seniors, persistent heartburn can damage the esophagus, affect the voice, and even increase the risk of cancer. As we age, the muscle at the entrance to the stomach weakens, allowing food and acid to rise. This is where baking soda, a natural antacid, comes in. When it enters the stomach, it reacts to neutralize the acid, producing salt, water, and carbon dioxide, resulting in less burning, reduced pressure, and quick relief. A 2018 journal on digestive diseases reported that small doses of baking soda rapidly alleviate chronic heartburn without the side effects caused by many over-the-counter medications. For example, proton pump inhibitors can deplete calcium over time and weaken bones. To use baking soda wisely, dissolve about 1/4 teaspoon in half a glass of water and drink slowly. Do not drink it immediately after eating. Allow an hour for digestion. Do not take the solution more than a couple of times a week without consulting a doctor, as frequent use can disrupt the acid-base balance. However, when used sparingly, baking soda is a gentle way to soothe heartburn. If you wake up with a sour taste or burning sensation, this simple and effective remedy is worth knowing. Number 12. Soothes itching and skin irritation. As we age, our skin becomes drier, thinner, and more sensitive. Heat, detergents, and air can cause itching, rashes, and redness. Many seniors suffer from nighttime itching and insomnia. Baking soda naturally soothes the skin by reducing the sensitivity of receptors. It also neutralizes bacteria and acids that exacerbate irritation. In 2016, a dermatology journal reported that baking soda baths reduced eczema-related itching by 40% in 1 week. Similar effects were observed with insect bites, burns, and hives. Baking soda acts as a mild anti-inflammatory agent, and its texture creates a cooling film. Add half a cup of baking soda to warm water, soak for 15-20 minutes, then gently pat the skin dry. Do not rub. For localized application, make a paste of water and baking soda, apply for 10-15 minutes, and rinse with cool water. Do not use frequently, especially on sensitive skin, but 1 to 2 times a week is an excellent method without hormonal ointments or strong agents. For seniors with flaking, dryness, and itching, this is an affordable remedy that reduces the need for expensive creams. Healthline number 11. Whitens teeth and fights bacteria. After 60, it's important to care for your oral cavity. Gums recede, enamel thins, and dryness makes teeth vulnerable. Many medications reduce saliva production, and saliva cleanses the mouth. Without it, bacteria become active, causing inflammation, cavities, and odor. Baking soda neutralizes the acid that causes these problems. Its mild abrasiveness removes stains from enamel without harm. A 2020 dental journal review found that toothpaste with baking soda better remove plaque and whiten teeth. It has also been proven that baking soda reduces harmful bacteria and improves gum health, and gum inflammation is linked to the risk of strokes and heart attacks in seniors. Type A training? You don't need to brush for long or every day. Simply, wet your toothbrush, dip it in baking soda, and brush for no more than 2 minutes. Rinse your mouth, and you can use fluoride toothpaste. For taste and benefit, you can add a drop of peppermint oil. For gums, dissolve 1 to 2 teaspoons in warm water and rinse once a day. This kills bacteria and reduces inflammation. Number 10, reduces muscle fatigue and increases endurance with age. Even simple activities, walking, climbing stairs, standing, become tiring. Muscles lose endurance, and recovery after exertion takes noticeably longer. One reason is lactic acid. During muscle work, it is released as a byproduct, accumulates, causing burning, heaviness, and we are forced to stop. Baking soda helps. It neutralizes excess acid in the blood, allowing muscles to work longer. A 2019 study in a physiology journal showed that seniors who drank baking soda before exertion felt on average 19% less fatigue, especially important for those who tire quickly or wish to stay active. Recovery is also accelerated. To achieve this, dissolve 1 to 4 to 1 to 2 teaspoons of baking soda in a glass of water and drink it 60-90 minutes before physical activity. Do not take it on a full stomach and do not exceed 1 teaspoon per day without consulting a doctor. In large doses, there's a risk of bloating and nausea, but in moderation, baking soda reduces heaviness and brings back the joy of movement. Number 9. Helps with burning during urination, a common issue among the elderly, especially women. A weakened bladder, hormonal shifts. Even without infection, there can be burning, pressure, frequent urges. The cause is increased acidity of urine. Baking soda alkalizes urine, reducing irritation. Dissolve 1/4 teaspoon in cool water. Drink on an empty stomach once a day, no longer than 3 days. Be sure to consult a doctor. Baking soda contains sodium. With the right approach, it's a gentle and natural remedy for pain without pills. For the elderly with frequent urges or discomfort, it's an unnoticed but effective helper. Number 8, supports the kidneys. With age, they filter blood. Less efficiently, waste accumulates in the body, leading to fatigue, swelling, and disease risk. Even slight shifts in acidity worsen the situation. Kidneys become overloaded and lose resources. Baking soda in small doses neutralizes acids, reducing strain and improving filtration, especially beneficial for those with early signs of decline. Take 1 to 4 teaspoons mixed in water once a day on an empty stomach. Do not exceed the dosage and be sure to consult a doctor if you have hypertension or kidney issues. In moderation, baking soda protects aging kidneys, improves blood composition, and prevents complications. Number 7, alleviates joint pain and reduces inflammation. Elderly individuals often experience joint pain due to arthritis, injuries, wear and tear. Often the cause is inflammation. Baking soda shifts pH toward alkalinity, calming the immune system and reducing inflammation. Dissolve 1/4 teaspoon in water, drink on an empty stomach once a day for no more than 2 weeks without doctor's advice. Effective with Epsom salt baths and compresses. If fingers swell in the morning, knees or hips ache, baking soda can be a gentle daily solution without injections and expensive procedures. In old age, immune cells often stay in attack mode, triggering low-grade inflammation. A large study found that when elderly individuals consumed baking soda, markers of inflammation in the blood decreased and the immune system became more balanced. After just 2 weeks, the body produced fewer pro-inflammatory substances, tissue damage was reduced, and the risk of chronic disease dropped. This is especially important for those who suffer from brain fog, joint pain, digestive issues, or constant fatigue, all signs of inflammation. Baking soda sends a signal to stop the internal attack and start healing. To do this, Dissolve 1 to 4 teaspoons of baking soda in a glass of water and drink it slowly on an empty stomach. Be sure to drink plenty of water throughout the day to help flush out toxins as inflammation decreases. Follow a schedule. 2 weeks on, 1 week off to avoid sodium buildup. Number 1. Reduces the risk of premature death in seniors with heart and kidney conditions. This is not just about well-being, it's about extending life. For those with kidney disease, hypertension, or heart failure, baking soda may reduce the risk of early death. It sounds serious, but this is backed by science. A 2020 study published in the Journal of Clinical Neurology observed over 5,000 seniors for 10 years. Those with low blood bicarbonate levels, i.e., a more acidic body, had a 62% higher risk of death from any cause than those with a normal pH bicarbonate. Is the very substance in baking soda a natural buffer that protects against excess acidity? When bicarbonate is low, organs are under strain, increasing the risk of heart failure, kidney damage, and chronic fatigue. Taking baking soda in safe doses raises bicarbonate levels, making the blood less acidic. As a result, cells function better, tissues suffer less, damage, and organs are protected. This lowers the risk of heart attack, dialysis, and stroke. Baking soda is not a medicine and not a cure-all, but it's a quiet, steady helper that supports internal balance. It is recommended to take 1/4 teaspoon of baking soda dissolved in a glass of water on an empty stomach. Elderly people with kidney conditions must consult their doctor first. But with approval, this simple habit can extend life. It costs just pennies a day and requires no prescriptions, yet gives your heart, kidneys, and immune system a powerful tool that works gently, deeply, and effectively. Baking soda doesn't just relieve symptoms, it can prevent the most serious threats. Conclusion: 13 major health problems that baking soda can help reduce, ease, or even reverse. Most seniors have never heard of these benefits. Now you know. This is not a myth. It's a scientifically proven remedy that's likely already in your kitchen. Which of these benefits surprised you the most? Share in the comments. If you want more simple, evidence-based advice for seniors without the hype, subscribe to the channel and turn on notifications. This isn't about life hacks. It's about taking control of your body and mind. Let's start now. Share your thoughts and questions below. Thanks for watching.